Hello relatives, welcome to this week's Schlagbyte for the week September 3rd, 2012. A couple of weeks ago I was with over 100 clowns from all over the world, and we gathered for our annual clown trip to Iquitos, Peru. Among the clowns were 20 health professionals, and for the first time we provided mental health clinics in the streets based on the Patch Adams Gesundheit healthcare model, which features open access to everyone and care that's delivered by open-hearted, loving providers as the foundation for doing healing work. The street clinics were the result of my work with Amazon Promise, an extraordinary nonprofit that provides primary health care for the indigenous people of the Amazon. I was the first psychiatrist who was willing to see patients in an open clinic. I shared the space with doctors, dentists, medical students, a lab tech. There was no privacy, and they didn't have any psychiatric drugs. Rosa, the clinic coordinator, served as my translator. She has a remarkable way of translating my words into her own story that clearly touched people. In 20 minutes, people could be impacted by the experience, and we loved working together and believed that with more mental health professionals that we could treat more people doing clinics in the streets. And this year, Rosa set up 4 half-day clinics in different communities. We printed flyers saying that if anybody was having problems since the recent floods, problems at home with spouses, children, parents, if they'd been abused, if they couldn't sleep, that there were professionals who could help them. I met with the clinicians who were psychologists and social workers and counselors, nurses, medical doctors, a chiropractor, and 2 body workers. And we got together before the first clinic, and I shared my experiences over the last 3 years in Belém. I said that they would be hearing stories that would make their hearts bleed, stories of abuse, abandonment, sexual trauma, and of course the overwhelming, grinding poverty. Stories that would make them wonder how anything in their training has prepared them for this. But I also told them that they would see people who were remarkably resilient, and that perhaps the most important thing that they could do was to come with an open heart and simply listen to their story. For many patients, 20 minutes with somebody who is truly listening to them is more attention than many have been paid to ever. In addition, they may be able to help them identify their strengths, maybe share some advice, even inspire hope, and that it would all have an impact, both on them and on the therapists themselves. We were not going to dress in our usual clown flamboyance, but we would all have our clown noses with us. And after our visits, we would give vitamins to everybody. I also brought along some amulets of the Virgin of Guadalupe, the patron saint of Mexico, that had been blessed by Huichol and Navajo shaman. I told the therapists that if they saw patients whom they thought might benefit from such a gift, a reminder of this time that they had spent together, that they give it to them with a little blessing when they hung it around their neck. We set up in a schoolyard soccer field, a loading dock, and in the Amazon Promise Clinic one day. When we arrived, we passed out the flyers and announced our presence over loudspeakers. The clinicians worked in pairs. They sat with their patients in tight little intimate circles, surrounded by clowns playing with children, veterinarians sterilizing dogs and cats, lab techs taking blood samples from children, and the community strolling by. And in the middle of this noisy three-ring circus, the therapist saw 200 people in those 4 days. They listened to each other's stories, and both they and the patients felt good about what happened. Skeptics may wonder if anything really meaningful can be accomplished in 20 minutes, and I say unequivocally yes. The overwhelming social and economic problems, they're not going to go away. But 20 minutes connecting to somebody with a listening ear, a loving heart, and a clown nose can kindle the human spirit and renew hope. Whatever our suffering, it is in those minutes, those moments, that we are reminded of our shared humanity. Take a look at the pictures, and for those of you who do healing work and are interested in learning about how to maximize your skills, take a look at my website. There's a workshop coming up in mid-October that you might enjoy. Have a wonderful, wonderful week. Take care of yourself and of others. Remember that we are all related. I say this for all my relations. Mitakuye.